Hi, I'm Kristen Coverley, Director of Professional Education at ABMP. We know that while some massage therapists have experience wearing personal protective equipment, or PPE, many of you have never worked with masks or gloves before. This video will explain the various types of PPE you might use in your practice and offer some advice and do's and don'ts about how to most safely put on and take off PPE. As part of ABMP's Back to Practice guidelines created in response to COVID-19, we recommended that going forward, both massage therapists and clients should utilize face coverings throughout the duration of their therapeutic interaction, from hello to goodbye. As ABMP indicated in those guidelines, the use of PPE will be central to reopening your practice when the time comes. Regulatory mandates may have already instructed you to utilize some aspects of PPE, specifically face masks, in your businesses or your daily personal lives outside the home. However, from the beginning of this pandemic, there's been a shortage of PPE, with most supplies being redirected to frontline workers and health assistance staff, like nursing homes and home health aides, who are still operating without the proper supply of equipment they need to work safely. Until the PPE supply chain is restored, consider cloth options for face coverings for you and your clients in the interim. For those therapists preparing to reopen their practice, having the right equipment and using it properly is imperative. But please remember, in lieu of a cure, vaccine, antibody tests, or other intervention for COVID-19, there is no 100% guarantee that PPE will protect you or your clients, or that either of you will come away from your therapeutic interactions unscathed. Let's take a quick look at the kinds of PPE as identified by the Centers for Disease Control and Prevention, the CDC, and how you don and doff, or put on and take off, this gear correctly and in its proper order to ensure that it does its best job of keeping you safe. First, let's look at the types of PPE you might need for your work with clients: gown or uniform, facial protection, eye protection and face shields, and gloves. While surgical gowns may be required for massage therapists who work in hospital settings, your gown in a traditional massage environment will typically be an apron, smock, or work attire of some kind that you can change between clients. These tops should be something you can unbutton or unzip to prevent having to pull soiled clothing over your head to remove it. You will want to change after each client. There are 3 types of facial protection as defined by the CDC: cloth face coverings, face masks, and respirators. The first category is cloth face coverings. These face covers are not officially considered PPE and do not necessarily protect the wearer. This is the type of mask currently being recommended by the CDC for the general public to wear when going outside the home. These face covers are intended to keep the person wearing them from spreading droplets when talking, sneezing, or coughing. Simply put, when you wear a cloth mask, you are protecting others. If you're using these in your practice, the best protocol is to have enough face covers so you can wear a clean one for each client. The second category is face masks. These are officially considered PPE and are often referred to as surgical masks or procedure masks. The CDC says to use face masks according to product labeling and local, state, and federal requirements. These surgical masks are designed to protect against splashes and sprays. While some PPE is coming back into the supply chain, you still might be limited on quantities you can order. Supply your office with disposable face masks for yourself and clients when you can. These are typically worn color side out, but check the label for directions. The third category is respirators. This PPE, which includes the N95 face mask, is used to reduce wearers' risks of inhaling hazardous airborne particles, including dust particles and infectious agents. It also protects those around you from being exposed to any of your droplets. This is the type of PPE mostly used by medical staff as they deal with coronavirus patients, and which has been in dangerously short supply. Once N95s come back plentifully into the supply chain, you might consider using these in your practice. In a massage or bodywork setting, if a client is asymptomatic but unknowingly has COVID-19, or if a client feels they can't wear a mask in prone position, then wearing an N95 mask could provide the best protection for massage therapists. Also, please note that recent expert guidance says N95 masks with a front vent are not recommended, as they protect the wearer but not necessarily others. These front vent masks are typically used in construction and are meant for one-way protection from dust and particles. This type of mask can emit droplets and would not keep your clients safe. A cloth face covering or surgical face mask would be preferred in this instance. Medical staff who are part of aerosol-producing procedures wear eyewear when working with COVID-19 patients. While this requirement has not necessarily been asked of massage therapists, estheticians will more likely than not need to utilize this equipment when working with clients. It's important to note that your personal eyeglasses or contacts do not qualify as proper PPE. Non-sterile disposable gloves, which are used for routine patient care in healthcare settings, are appropriate for use in your massage practice. Gloves can be used to make taking payments safer for clients and practitioners. You should also use them during sanitation protocols and if administering any facial work during your session with clients. You may also have clients who would be most comfortable having you wear gloves throughout the entire session, so it's a good idea to get comfortable using them. Now let's take a look at how to don, put on, and doff, take off, this PPE. To put PPE items on, you need to don them in this order: gown or uniform, face mask, face shield or eye protection, and gloves. To remove the items, start with your gloves, then your gown or uniform, your face shield or eye protection, then your mask. To begin, we'll assume you've washed your hands and put on your gown or uniform in preparation for your next client. Now let's look at how to don and doff the rest of your PPE. Face coverings are recommended by the CDC in all instances where you can't follow proper social distancing. To put on your cloth face covering properly, start by grasping it by the ear loops and securing them behind your ears. Make sure both your nose and mouth are covered. Some face coverings have ties which you would fasten behind your head. While this face covering is on, do not touch it. If you have to adjust it, do so from the ear loops, not the face of the mask. To remove your cloth face covering, grasp the ear loops and remove the covering carefully. Do this in an area away from others. For tie masks, loosen the bottom ties first and then the top ties. Once removed, fold the mask in half on itself with the dirty side folded inside and place it with soiled linens to be washed. Best practices would be to don a fresh face cover for each client. To put your face mask on properly, start by holding it by the ear loops with the color side of the mask facing outward. Once secure over your ears, hold the top of your mask by the bridge of your nose with 2 fingers as you pull down and lengthen the mask to fit below your chin. Now secure the metal clip around the bridge of your nose. Do not touch the exterior of your mask while you are working. To remove your face mask, grasp the ear loops and remove them carefully so as not to disrupt the exterior of the mask. Dispose of your mask and start with a clean one for each client. To put on your N95 respirator properly, start by holding the respirator in the palm of your hand with the metal nose piece by your fingertips. Bring the respirator up to your face, and then bring the top loop over your head and have it sit high, above any ponytail or bun. Next, bring the bottom loop over your head and around the back of your neck. If you have long hair, the strap must sit under your hair. Make sure the straps are not twisted. Secure the positioning. Then, using 2 fingers from each hand, mold the nose piece over the bridge of your nose, moving outward from the nose as you go. Conduct a fit test, feeling for air escaping from the mask as you exhale heavily. If you feel air escaping, reposition the straps and rework the nose piece. Retest until you're sure the respirator is secure. Do not touch the exterior of your mask while working. Note, this PPE is only effective if you can create a tight seal. Those with beards or facial hair may have to opt for a face shield instead. To remove your face covering, start by bringing the bottom loop back over your head. Retain your hold on this loop. Next, remove the top loop, being careful not to touch the exterior of the mask. Discard a respirator once it is wet or soiled. To put on gloves, make sure the glove extends to your wrist. This is the last item of PPE you would put on before seeing a client. It is also the first piece of PPE you would remove. To remove gloves, using one of your gloved hands, grasp the palm area of the other gloved hand and peel off the first glove. Hold the removed glove in your gloved hand. Slide the fingers of the ungloved hand under the glove edge at the wrist and peel off the second glove over the first. Discard the gloves. Do not reuse gloves. We hope this helps take the mystery out of using PPE. Please continue to reach out to ABMP with questions as you learn how to use these new tools in the therapy room, and as always, follow the CDC guidelines for best practice. When you do choose to start practicing again, please use PPE correctly to create the safest possible environment for you and your clients.